I'm Dr. Grace Chung. I'm from Henderson, Nevada, and I work here at Smile Shop Dental and Facial Aesthetics. And we first opened our dental practice in 2016 in March, and it's been almost 3 years. And within the last year, we've opened up our facial aesthetics branch of our practice. So it's Smile Shop Facial Aesthetics, where we offer Botox, dermal fillers, Kybella, injectables, facials, and we kind of incorporate our whitening and some of our aesthetic consultations in here as well. And it's been a wonderful addition to our practice. The AAFE is something I one day received a flyer in the mail, and I've always kind of been interested in a little bit of the injectables and learning. It's difficult when you have lots of avenues to learn, but the AAFE is very consistent with the enforcement that they're going to teach and the information and the resources that are provided. So the training that I received all the way from level 1 and then each subsequent one has been very much in depth. It's all available to me anytime I want as a member. The resources on the forum, the mentors, the accessibility of the paperwork, the diagrams, and even the staff that work with the AAFE. When I have a quick email question, I get something back that same day. It's been just very, very helpful in growing the practice, not just clinically for knowledge, but also the management and the business side. And my entire team was able to train with the AAFE for business management, marketing, and how to speak to patients. And it's been, everybody loves it. The online portal and the education that's provided has been really resourceful and great. Well, I love that it's a little different, and I love that it challenges me on a different level clinically. Understanding the modalities and the muscle groups and just how things work. But what I really love is just patients and how happy they are to see me. Nobody comes in, afraid or nervous. Like, they're all just pretty excited. It's very simple, very predictable, with the training that the AAFE has provided. I feel like, when you have all the information you need and you just apply what you've been taught, it's very predictable outcomes in some regards. And then we learn how to fix things up and touch-ups, and I don't know, it's just been a very fun experience. It's just exciting to see a different aspect of growth that's just outside of dentistry. They love it. My patients, our patients here after their hygiene appointments, they'll come in and do a quick Botox touch-up. They love their injectable, their lips. We've been using the Botox a little bit for that gummy smiles, kind of fixing a little bit of a cant on their smiles. So it's been a very added bonus to, I think, just a great service to offer for all our patients. Very, very well. The production of the office has just been skyrocketing on a different level. In a given day, I could sit and kind of my dental patients might fall off the schedule, but if our aesthetics patients come in, it still balances things out. And it just adds a little bit more with a little less effort. When you are looking to increase production, just in dentistry, it takes a lot of overhead, a lot of training, a lot to do that. And I feel like offering these types of services has helped kind of add to that. Even if it's just a bonus, it's not done for the production alone. It's for fun and for an added service, but it's been really helping a lot with our bottom line. Yes, so I finished a crown prep on number 30. It was a broken amalgam restoration, MODB-L, the whole thing, building it up, prepping the crown, packing the cord. I get up and I walk away, and then my aesthetics manager comes and tells me I have 50 units of Botox to inject. I did that, and then I went and sat down and thought about what I just did, because the revenue that I received was greater on the Botox end than what I just did with the crown prep, at least initially for the patient's portion. And it was maybe 15 minutes of my time just chatting, 2 minutes of my time to inject, not even. And the crown prep took me, a good 30 minutes of sit down time, numbing and all that stuff. And I was just thinking, like, drinking my cup of coffee about how great that was to double that just by, standing up and doing a quick little thing and making someone happy. It was very good.